Hi, good afternoon, and thank you for joining us here for another segment of Wildlife Wednesday. My name's Rachel, and I'm going to be taking you down to the hospital today to learn a little bit more about how Crow diagnoses its patients. So on last week's segment, we looked a little bit about what happens as animals get to the hospital and how we determine whether or not they are sick, injured, or orphaned babies. Well, this week we're going to take it a step further by allowing Missy F, one of Crow's certified veterinary technicians, to tell you the importance of blood work in two of our patients, both an eastern screech owl as well as a gopher tortoise.
This is our lab area. We just had a new patient come in, a screech owl, and we took a little bit of blood from this little guy. So you can see our blood tube here, which is a hematocrit. And I'm going to spin that down, and then I'm going to read it afterwards, and we're going to find out what his blood work looks like. It'll tell us immediately what his packed cell volume is and what his total solids is, which can give us a lot of information right off the bat for the vet to decide what the next treatment plan is for this animal.
Hey Missy, when we're doing packed cell volume and total protein, what types of information can that give us about the animal in terms of treatment?
So it can tell us if the animal's anemic, dehydrated, if the animal's had starvation, if they've had blood loss in another way, where they might need to get an IV catheter placed where the vet can tell us exactly what fluids specifically the animal needs. So this little tiny hematocrit can give us that much information right off the bat.
That's amazing.
So we're going to spin it down. You can see it in there, the two different. This one's been spun down. I'm using it as a balancer. So our hematocrits are done spinning, so we're going to go ahead and read them. You don't need very many things. You need the card to read the PCV, packed cell volume, and you need a refractometer. So just these two things will give us a lot of information.
And Missy, again, a hematocrit tube is a blood reading, correct?
Exactly. So this is our little blood reading here. And I don't know if you can see, but this is the liquid portion of the blood. And there is a little buffy layer here, which is the white blood cells and platelets. And then these are the red blood cells packed down at the bottom. That's why it's packed cell volume. All the cells are pushed down to the bottom of the clay, depending on their density. So we're going to take the hematocrit and hold it up to our little card here. And I want the clay at the bottom, and I want my liquid portion at the top, so it's as easy as just reading across that this animal has a 25% packed cell volume, which is pretty good. And I think this is actually on a gopher tortoise, so that's actually really good for a tortoise.
Now, Missy, we were talking about getting blood on like gopher tortoises and birds. Do they all have the same values, or are there going to be certain ranges depending on what we're dealing with?
That's a great question. So every animal has a different value. Sorry, I got mask here. Every animal has a different value, depending on if it's a turtle, tortoise. They all have different values, which is the normal range. Also, the birds and mammals all have a different range that's normal as well. So this guy actually is within a really normal range for a tortoise. So we read our packed cell volume, so I'm going to record this into the book here. So 25%.
Do we keep track of all results from these tests in our logs?
Yes, we do. So every patient that gets blood, they go into our logbook, and at the end of the day, the vet techs go into the computer and enter everything into the computer, so we have access to every patient's record. So I'm going to go ahead right now and read the total solids. So there's kind of a neat trick we do here, where you can take a slide, make a little score here, which makes a cut line, almost like if you cut tile, let's say, and it will break perfectly for you, so you're not going to have a bunch of shards of glass. We're going to put that on our refractometer without touching the glass to it so you don't scratch it. Flip that down, and I hold this into the light, and this is 3.8 grams per deciliter. So that's very normal for this animal. So this guy had a great reading. If the animal was dehydrated or anemic, you'd be able to tell right away by looking at the blood tube, depending on how much liquid portion or how much of this red blood cell you see. So it can be an immediate reading by just glancing at it.
So you just saw Missy reading blood work on one of our gopher tortoise patients, who they will then use to determine an appropriate treatment plan. After this, Missy's going to take us behind the scenes into one of the intensive care unit areas so we can see her administer fluids to our eastern screech owl patient.
So what I was doing in here with this eastern screech owl is hooking him up on a fluid bolus. We were giving him hypertonic saline, which actually will help relieve the pressure on his little brain. He was found in a parking lot, so he could have been hit by a car, he could have hit a window. And so this little guy is getting supported that way. So our blood that we took earlier, Hematocrit, told us that he's also dehydrated. So this little guy is going to also get fluid after he's done with his bolus, which means a volume of a liquid over time. So he's getting a bolus for 15 minutes, which will help relieve the pressure in his brain. He's also had pain meds, and he's also had x-rays too already, which we didn't see any fractures.
Thank you, Missy, for showing us all of these wonderful things at the hospital today. We definitely appreciate all of the efforts our medical team takes to get these animals back out into the wild. And thank you to our viewers for joining us for this week's Wildlife Wednesday. If you enjoyed what you learned about during this segment, please click on the donate button above or continue to follow us on our website for more updates.